Welcome back to a special edition of The Doctors, the good, the bad, and the gross body problems. There's no question we've discussed and diagnosed some pretty disgusting things on the show, especially this guy, Dr. Sears.
We're going to talk about decoding your burgers right here. All right, so this is my giant nose, and suppose something like this. Blow your nose. All right, suppose something like this came out. Now, a lot of people think that color is actually from bacteria, but it's not. Actually, the color actually comes from the body's own immune system sending white blood cells, which have a green enzyme in there, and that kind of that's what turns the mucus yellowish green. More of a reddish tinged mucus, kind of thick stuff. Now, especially during the winter time, you know, you got the heater on, the air's dry inside your nostrils are getting it's getting dried out in there, irritated fingers are crawling up in there. You're gonna get the blood-tinged mucus, all right? Now, if it just happens occasionally, not a big deal.
There are other ways you can decode your baby's health. Some of them start in the diaper, Dr. Jim.
Just look at the diaper and it can give you some really great clues on how baby is doing. Now, there's a lot of colors you're seeing here, right? And so I'm going to talk about which ones mean what. Stools are going to look like kind of a black, greenish, tarry substance. It's called meconium. It's going to look kind of like this. Now, this isn't actually stool. It's the stuff that's been sitting in the baby's intestines for a long time. You know, there's some old skin cells, some mucus in there. And this doesn't really smell too bad at all. So you may not even know it's in there. So that's why you got to check the baby's diaper pretty frequently. Now, when the baby starts really digesting the breast milk, it's going to turn more of a yellow color like this, all right? Now, a breastfeeding diaper actually kind of tends to have more of a sweet smell to it, and it will literally look like somebody just squirted mustard and cottage cheese, mixed it up and squirted it into the diaper. When the baby's born, you cut the cord, and you know what it is, that stump dries up and eventually falls off between about 1 and 3 weeks of age or so. But you know, until it falls off, it's essentially decaying skin. It's decaying tissue, and there can be a little odor to it.
You know, so quickly going through those three things, we talk a lot about colors on the show, mucus in particular, and in reality, if you're thinking about things like sinusitis, a better way is beyond just the color of the mucus is if you're having significant worsening sinus pressure, even a toothache, along with fever. If the congestion is lasting for weeks on end and you really are having almost systemic symptoms, you have to worry about a true bacterial infection of the sinuses.
Oh, yeah,
But you don't want to bank on color, even though it is sometimes something that's going to give you clues.
It's more about color change, and it kind of goes the same with poop. You kind of want your poops to be fairly consistent. You know, always about the same thing. Same time of the day would be nice, same consistency. And if you see a change and it stays that change, you know, it can change, you know, get a little hard, pebbly, or a little runny every once in a while, but if it changes to something else, then you want to do something about it. Change your diet, change something else, change how much water, juice you're drinking, you know. And then umbilical cords. They can be pretty gross, but you want to keep them dry and not irritated. So a couple of tips. A lot of the newborn diapers have a little cutout to kind of let the belly button on the umbilical cord flop out there so it doesn't rub on that diaper. And then lastly, until it falls off, you want to keep it dry by not giving the baby a bath immersed in water. So sponge baths for the first couple of weeks until that cord is off.